The coronavirus crisis deepens as more and more cases are being diagnosed across the globe and right here in our state. There is a lot of information out there to take in, and who better to sort it all out than an infectious disease expert? This week, I sat down with Dr. Chad Sanborn to talk about the pandemic. Here's what he had to say. Dr. Sanborn, thank you so much for joining us.
Thank you for having me.
So, state of emergencies, flight cancellations, event cancellations, this has now become a pandemic. First of all, do people realize what a pandemic is?
You know, I think people are learning if they don't already know, but I think the important thing about it, in some respects, in the medical field, we view it as just kind of a change in terms, but to stress the importance that it is something that is affecting the whole world, that will likely continue to affect the whole world. We're not alone with this, nor is it some far-off place that seems to be suffering the effects of this. So it's not meant to scare people, although it does to some extent, but I think it's important to realize that this is something that will be ongoing in multiple places and impact people's lives in multiple places.
There's a distinction between panic and concern. At this point, we should be concerned.
Yes, I think panic doesn't really serve anyone very well, unfortunately. But you see a lot of that in the community when people are buying up the shelves. People are stressed out, even if they weren't beforehand. When they go to the store, they don't see supplies there. People begin to panic. You know, I think here in South Florida, it's great because we're used to hurricanes and hurricane preparedness, so maybe a little bit different here than the rest of the country. But I think concern means you have to make your own decisions, and what's important to you may not be important to your neighbor in terms of your risks, who you live with, who you're exposed to every day, where you work. So a lot of people are put on the spot to make important decisions in addition to trying to listen to the health authorities. It makes it difficult.
Let's talk about the origin of coronavirus. Did it begin in China?
So yes, we believe it did begin in China. We're not exactly sure how in terms of mechanism, but we believe it came from an animal species, very likely that had this phenomenon where it was able to jump species from an animal to a human, potentially a human or humans that were infected with a common coronavirus, which is something we see every year, something that is not lethal, something that will normally present as a common cold. Unfortunately, what we think may have happened is that this newer form of coronavirus kind of promoted the best or the worst in this case of both worlds, in that it was very easily transmissible, as coronaviruses are, from person to person, and in this case it was new. So potentially from some animal species, nobody has any immunity to it, which is why it's such a big problem for the world.
Was it ingested from an
We don't know. We don't know if it was ingested from a meal. Was it just close contact? That we're unaware of, and potentially in time we may be able to determine that, but right now we do not know.
You said it's easily spread. How does it spread?
So what we know is that most coronaviruses are going to be spread via a droplet route. So one way is by two people in close contact, someone sneezing and coughing, not covering their mouth, or covering their mouth but not completely. Droplets can spread to another person within 3 to 6 feet. Another common way, especially with kids, which seem to be a reservoir for a lot of these viruses, is they cough, they sneeze onto their hand, they drool onto their hand, they touch a surface, someone else touches that same surface, knowingly or unknowingly, and touches their face. So that's a way we can infect ourselves and keep the train of transmission going, if you will.
Is it true that young kids don't get coronavirus?
So that's a fascinating question. I wish we had more information about. So far, out of the data from China, it seems that only around 2 to 2.3% of children seem to be infected with the virus out of the total population that's infected.
When you say children, what ages?
So they're looking at less than 14, 15 years of age. Beyond that, it seems like the children who are sick with the virus are not very sick. Only about 0.1, 0.2% in the big study of over 1,000 people in China seem to get severely ill, and there were no deaths. And we have not seen different scenarios in other parts of the world, meaning we think that children probably get it. So the two theories is that either kids don't get it, which would be unusual because kids get everything and they're touching things and putting their hands in their face, or that kids get it but don't get very sick. I think the latter is probably true. We need more data, more studies to determine who gets it, gets better, and maybe never knew they had it, or minimal symptoms when they get it.
You say that it's easily transmitted. Does a mask help?
Yes and no. So a mask would be useful if a person is having symptoms of an illness. So if I'm coughing, I'm sneezing, I have a fever, or any combination of those, having a mask on will hopefully prevent me from spreading to other people. That being said, in the general community, wearing a mask is not going to be very effective in preventing you from getting illness, and may, in some circumstances, make it more likely for you to get sick if you're adjusting it all the time, touching your face, or lulled into a false sense of security where you're not avoiding people who are coughing and sneezing because, oh, I have a mask and I feel I'm okay.
So who's most vulnerable? We know that the children now, they don't get it too bad if they do get it at all. Who's the most vulnerable?
Yeah, so it seems that adults over 60 in general, and adults with other medical conditions, hypertension, diabetes seem to be two big ones. Smoking was thought to be a risk factor as well, but certainly people who are over 60 seem to do worse when they get the virus, get the brunt of illness that ends up in the hospital, at least with the virus as well.
What are the symptoms or the common symptoms of it?
Yeah, so that's another challenging point, is that it's very similar to common cold or to seasonal flu that we get. What we seem to think is that a dry cough, kind of a fatigue, a big fatigue seems to be one of the big symptoms, and just body aches, but sore throat can be part of it as well, non-specific things. But we seem to see less runny nose, less gastrointestinal symptoms with this than you do with a common cold or a flu virus. Not as much body aches per se, but fever, dry cough, and fatigue are big symptoms in this illness.
So when should you go to see a doctor or go to the urgent care or to the hospital?
Right, so I think it's a fine balance we have to play, right? We can't have everybody rushing to the doctor or to the urgent care center or to the hospital at the very first sign of a sniffle or not feeling well. Majority of the time, even if this does spread, you're probably more likely to have something else than this coronavirus. However, certainly if you're having difficulty breathing, if you are unable to eat or drink because you have no desire to and you feel like you're getting dehydrated, if you are physically ill and just can't get up and get out of bed and can't get around, those would be signs that, yeah, maybe call a friend, a family member to either take you or get in a car and get yourself to a medical provider. And it's another important thing would be to be in contact with your primary care provider. Give them a call. Hey, these are my symptoms. I'm not feeling so great. Should I come in to be seen in the office? And maybe giving them a heads up for certain providers will be helpful so they can plan for your arrival. Thereby, you're not exposing yourself to a waiting room of people who might be sick or might be immune compromised where they can get sick from you.
What is the status of the test kits?
So, as of right now, we are still unfortunately a bit underprepared in that we cannot get tests to everybody that should, in my opinion, be tested for the virus. Certainly the very sick people and people with a travel link, yes, we seem to be doing pretty well at getting testing for those. However, I think there's a big portion of the population that are not fitting the criteria the CDC puts forth that should and can be tested, but we don't have quite enough infrastructure at the moment to get those people tested.
Okay, so say you get tested and you are positive for coronavirus. What is the treatment? And does it work?
So no, so there is no great treatments just yet. The short answer would be no, obviously. But common sense things that we've heard from grandma, from abuela, from people for a long time would be, try to eat right, try to get sleep, try to drink plenty of fluids would be helpful. There's not a well-established medicine that you can take for this at this point in time. Hopefully we're getting to the point where there will be a medical treatment for it, but right now it's really supportive care. Even in a hospital, there's no magic antibiotic that they put you on to make you feel better, unfortunately.
When people die from coronavirus, what is it that they die of?
Yeah, so what we're seeing in the people in China, again, where most of our early data comes from, is that people seem to start off with a respiratory illness, mild upper respiratory symptoms, progresses to their lungs. From there, their lungs, their body's immune system in their lungs in particular seems to overreact. So you have this vigorous immune response, which causes lots of inflammation, decreasing oxygen ability of the body to process oxygen, and then liver, kidney disease, and things like that from this stimulation of the immune system.
We've heard so many cancellations of public events, many flight cancellations, state of emergency. Should we be under a quarantine at this point in time?
Not yet. I think for certain communities it may be useful, certainly if they're seeing lots of ongoing transmission in the community. Public health officials, politicians will have to make those tough decisions. For the whole country to be on quarantine, no, I don't think that's necessarily very useful at this point in time, especially as we see ongoing transmission, which I think is likely from different individuals in the community, meaning it's already here, it's around, and quarantining everyone may be also infeasible, but also might be not particularly helpful at this point in time.
Last question. Do the Lysol wipes, the hand sanitizers, do those things work?
Yes, they do seem to work pretty well at killing the virus virus on surfaces. You know, hand wipes at the very least is reminding you that, oh, my hands are probably dirty and I should probably clean them before preparing food. Touching my face. They're not a cure-all. I wouldn't, you know, expose yourself on a bus or a subway, touch everything, and then think, oh, I'm fine. Then I can go eat my sandwich afterwards. You know, you should wash your hands when you can, when they're visibly soiled. But these products do help us prevent spreading the disease and getting the disease ourselves.
Boy, you answered most of our questions, Dr. Sanborn. Thank you so much.
Thank you.
Appreciate it.